Hi, this is Dr. John Turner. We hope you join us for our Chiropractic Brain Balancing Seminar November 1st in Bloomington, Minnesota. One of the first things that we teach is how to quickly and efficiently look at someone's posture and determine the distortions that are going on within that posture to know exactly how that brain is out of balance. We'll not only know the particular pain patterns that they'll be experiencing, but we'll also know some of the mental struggles that they're going to be going through based on the fact if they're dealing with a right-sided brain imbalance or a left-sided brain imbalances. So first thing, we're going to teach you how to look at posture, which you already know how to look at, but how to pick out those distortions that you're going to see very quickly once I point them out, so that you'll be able to use that information to also apply it to your chiropractic technique. The beauty of teaching chiropractors how to influence the brain or affect the brain is that you have already had all the information and all the different skill levels with the different techniques that are out there. We just show you how to apply them in a very specific manner to make changes in the brain. The next thing we're going to teach you is how to basically work with extremity joints by doing what we call muscle stacking, by testing the different muscles of a joint, and how to basically get the brain to recognize that dysfunction and to be able to turn those muscles back on. We'll demonstrate in the seminar how painful areas will be able to move quickly and better and less pain right after one treatment. So the results of what we do are very instant, and clients will appreciate this type of work because they're going to feel the effects after the work's been done. Also, we're going to talk about how to get involved in determining the struggle or stress on the brain. In fact, we'll be able to see what part of the brain's not functioning properly and what we can do to basically turn those areas back on. One of the things that clients will typically tell us on a regular basis, that after this type of treatment, that they're going to feel more balanced, they're going to feel more grounded, they're going to feel less stressed, and they're going to feel that they have the ability to deal with things in life in a much more effective manner based on the techniques that we're going to teach you. We're going to talk about how the different imbalances based on brain dysfunction will correlate to injuries, and why a person will be more prone to injure one side of the body in comparison to the other. And we'll educate our clients while we're doing this technique so that they'll have a better understanding why they're coming back, because we have found numerous things that are wrong with them, not only based on their spinal distortions, but why the brain is holding that distortion pattern in such a way to compensate in life. But unfortunately, if they are a performance athlete or they're just someone who's trying to get in shape, they're going to struggle with certain pain patterns based on that distortion in the brain, and how we can quickly deal with that, and they're going to feel better and they're going to want to come back in. You're not going to have to tell your clients that they need to come back in 10, 15, 20 times. They're going to understand why they need to come back in, and we're going to be teaching that aspect of how to educate your clients quickly so they understand what you're doing. We find this very effective in our practice, and our clients love to come in and get this type of chiropractic brain balancing technique. And be honest with you, I don't really do anything other than that anymore. I don't really just take care of somebody that has a shoulder problem. We basically get in and do the exam. We find out where the brain's out of balance, why it's affecting the shoulder, and we can relate it back into the spine, and how the spine and the brain are very closely connected, and how we can make changes in those distortion patterns and in those stress patterns in such a way that a client's going to feel better. The next thing we're going to talk about is something called central integration. Not only do we have our normal peripheral nervous system where we'll have unilateral side problems, but we also have this central integration problem from the brain coming down through the spinal cord, and how that can affect organs. A lot of organ dysfunction comes from what we call that visceral somatic response as it reflexes into the spine, and we're going to be able to determine this very quickly, this central integration problem, and be able to deal with things like digestive problems, being able to deal with respiratory problems, being able to deal with bowel and bladder function. These are common complaints that your clients are going to have that we can now address by dealing with this central integration. Lastly, we're going to show you how we use some very efficient tools, not expensive tools, but certain things that you can implement in your practice. We find that once we teach the principles and how simple they are, your visits will not increase in time. In other words, you do not need to worry. To do this protocol is not going to increase the visit time dramatically. Our visit times are well within 5 minutes. And we even upgrade, if we're going to 7 minutes, that's going to be a little bit more of an additional cost, and clients are willing to pay. In fact, in our practice, we don't even bill insurance because our clients want this, and it doesn't really matter whether insurance it pays or not. Your choice. You can still bill insurance because you're doing a chiropractic procedure. You're improving spinal function. You're improving nerve function. You're improving blood flow. You're improving central integration of the nervous system. You're improving brain function. All these things that the way that chiropractic was originally founded, that if we can affect the nerves and we can affect it in such a way that we know normal function is going to return, and when that does occur, our clients are going to experience the benefits of that. So we definitely are excited about our seminar that will be in Bloomington, Minnesota, November 1st. I will be the instructor. It's going to be a hands-on workshop, so be prepared to be worked on, because that's the way I teach seminars. You're going to learn through the process of seeing and doing and watching me also treat others, and the process of learning it, that you'll be able to implement this the next day you go back into practice. You will not have to do a lot of study. You certainly will want to study some things, but you'll be able to bring this back into your practice and be able to implement this on your existing client base as well as your new client base, and certainly take off with being able to explain more of the function of what chiropractic is about, how it relates to the spine, the nervous system, but ultimately how it relates to the brain. Because in this day and in this age, we need to get our clients to understand that brain health is just as important as spinal health, and they're both connected, so we better be able to do that very quickly and very efficiently. Thank you for your time. Hopefully we'll see you. Looking forward to meeting you guys out there, and we welcome you to our seminar. Thank you so much.